Welcome to Business Briefings, a resource from the Cincinnati, USA Regional Chamber to help you and your business navigate this COVID-19 crisis. I'm Jill Meyer, the President and CEO of the Cincinnati Chamber. I invite you to share with me or with other members of our team how we can best help you and your business weather the storm. I hope that you have already tapped into the many resources available at cincinnatiChamber.com and that you are getting our daily emails updating those resources in real time. As we begin our webinar today, I want to extend my sincere wish that you, your families, your employees, and your community are healthy and are exercising all the appropriate cautions to avoid infection. Our own team is working remotely to increase their safety and to decrease their likelihood of contracting the virus. We look forward to the time when we can return to connecting with you in person. We look forward even more to the time when we will demonstrate the Cincinnati region's remarkable resilience as we emerge from this crisis stronger and better than ever. Meanwhile, you can expect from us a regular sequence of timely online events focusing on topics of urgency in this challenging time.
Everyone should know about COVID-19 are responding to the crisis. This briefing will cover the facts on what's going on across our Cincinnati region. You have joined this briefing in listen-only mode with your microphones turned off. Questions for our experts can be submitted in writing through Zoom's Q&A window, and Michelle Rayburn, my colleague, will make this all work for all of us. We'll cover as many questions as we can within our 1 hour time frame. And if you us by phone or need to sign off sooner than 2 p.m., do full webinar later on Facebook. We're fortunate to have two experts and leaders in our community guide us through this topic today. Rick Lofgren, MD, MPH, FACP, is the president and CEO of UC Health, the University of Cincinnati's affiliated health system, with more than 11,000 employees, physicians, and advanced practice providers, hospitals, and more than 30 outpatient locations in 3 states. Dr. Lofgren is a board-certified internal medicine physician and administrator with more than 40 years of experience in healthcare. He is currently serving on Governor DeWine's advisory board on COVID-19, and he is a member of the board of directors of the Cincinnati, USA Regional Chamber. Christa Hyson, MPH, is the Senior Manager of External Relations and Public Information Officer for the Health Collaborative. Ms. Hyson's work arms the public, community partners, and government agencies with functional health knowledge to build public. Prior to joining the Health Collaborative, Ms. Hyson worked for departments of health in Cincinnati and El Paso. Her work during the recovery from Hurricane Harvey earned her a President's Volunteer Service Award. So let's hear from them. Welcome to both of you. Dr. Lofgren, I heard you say at a meeting earlier this week that our region is prepared because we are prepared. We have prepared. Can you elaborate on what you meant by that and give us your take on how the region is responding to COVID-19?
First of all, thank you, Mary. Thank you, Jill. Thank you for giving me the opportunity to speak to our community. And I also want to share my gratitude and thanks in wishing everybody that they're safe and keeping themselves safe. These are truly unprecedented times, and I have been overwhelmed but not surprised by the response by this entire community in our hour of need to make sure that we're here to take care of one another. I thought I'd take a minute to provide you a perspective from a health system view. First of all, as Mary said, I think one of the things that we need to understand is that we are prepared because we have prepared. This is something we do as a community on a regular basis. We have exercises to really make sure that we don't have, that we're prepared for any kind of natural disaster such as this. We are simply activating the plans and policies that are already in place and that we've already prepared in advance. At UC Health, we have a COVID-19 team made up of our Chief Medical Officer, Dr. Dustin Calhoun, who is really a regional emergency room physician responsible for emergency preparedness for the entire region, and Dr. George Smulian, an infectious disease expert and a preventionist. And they're working every day implementing, modifying, and making sure that we're implementing and preparing for this particular pandemic. I think the other thing that I want to make sure that I express and convey is the level of coordination and collaboration that is happening across the entire community. At a state level, as Mary mentioned, I actually have the opportunity to serve on the Governor's Advisory Group. And one of the things that I was very impressed with from the very beginning was a recognition that the healthcare leaders across the state needed to be consistent both in our message and the way in which we were responding to the infection. We really need to convey to the community that we've got this, we're working together, there's no need to panic, there is need to act though. I've also been impressed that the governor was willing and able to listen to the healthcare providers and really take bold and what were at the time unpopular moves to really protect the community. And I'm confident that those actions that they took at the state level to ensure the safety of our community will save many Ohioans' lives. I think the other thing I would mention is, as a community, we should be really comforted and proud of the Health Collaborative. I know in a moment you're going to hear from Krista, but you know, it is a unique asset that we have in this community. It is an organization where all the healthcare systems within the community meet on a regular basis and collaborate with one another to do what's in the best interest of our community. And there's no time like this in which that history of tradition of working together is any more important. We share our learnings, we're actively working with each other, we're planning, we're thinking about capacity as this infection arises and whether the need occurs. The other thing I would tell you is that the infection is in our community and it will grow exponentially. One of the issues right now is that for many people, they don't know a lot of people that have been infected, but by the time the infection becomes evident to everybody in the community, it's too late. And the goal here is to slow the rate of the progression of this infection in our community. And in doing so, it will prevent us from overwhelming our capacity to care for patients with the various healthcare services available throughout the greater Cincinnati region. And the key to that is simply social distancing. The infection, the COVID-19 infection, is a respiratory infection. In fact, when somebody has the infection, when they cough and sneeze, small droplets containing the virus will spread. It only spreads about 3 to 6 feet, but it can be aerosolized for a period of time. However, a good piece of the infection is spread by contact. An individual who is infected may cough on their hands and then touch a surface, shake a hand, and that way, as another uninfected individual will touch it, touch their face, and acquire the infection that way. That's why hand hygiene, disinfecting surfaces, and in fact, social distancing becomes important. Not only is it to avoid sick patients so that you're not in the direct line of a potential cough or a sneeze, but also distancing to make sure that you don't have unnecessary contact with somebody who might be infected or have the infection carried on their body without knowing that. These are important measures that will make a big difference in slowing the infection. I will tell you that we have two pressing issues in terms of our response currently to this impending pandemic. The first one is the lack of personal protective equipment called PPE. These are the gowns and gloves and masks that healthcare providers use to actually protect them so that they can care for individuals. Our supply of those PPE equipment is actually very short. We are working very actively, and again, this is where the collaboration across the state and within the region is really making a big difference. We've heard from many people in our community and other businesses that have some of this equipment that have been willing to donate that to us, and I really thank you for that kind of contribution and thoughtfulness. The other challenge has been the timing and availability of testing. This really does hinder our ability to fully understand the impact of the infection and as it's spreading across our community. It's becoming more and more available. We at UC Health and other healthcare providers in the community have set up drive-through evaluation tents so that individuals don't need to come into their physician offices and potentially infect other people, other patients waiting. I think this has been a real asset. Again, reflecting the kind of collaboration and cooperation we're seeing across the entire community. So in summary, I would tell you that we are well prepared as an organization and a community. We've been practicing and preparing for a situation such as this. We have a rich tradition through the Health Collaborative of having the health systems come together to make sure that we're devoting all of our resources in the care of our patients. It's important to recognize despite how difficult it is, that social distancing is very important to really slow the rate of the infection in our community. That will allow us to make sure that we have the capacity and facilities to care for everyone who might become in contact and infected with the virus. Thank you.
Dr. Lofgren, we are going to move on to Christa in just a moment, but we have questions coming in which we'll take later. But you said one thing that I'd like to ask you about right now. You talked about the exponential growth of cases of infection by the virus. And earlier you had said that it was important for us to understand the difference between panic and also the importance of acting. And can you elaborate a little bit more on that? And from your frame of reference, what's the difference? How does one not panic, and how should I act, in addition to the safety precautions you've already mentioned?
Great question. You know, I appreciate for all of this that this is a highly anxiety-provoking moment. You know, these are uncharted waters for most of us. The idea that the community has been shut in and how disruptive it has been is really anxiety-provoking for all of us. I think the thing that I would tell you, though, is that we do have a good understanding about how these infections spread, how they can be best mitigated, how we can care for patients. It's also important to recognize that still a large part of our community will not become infected, and those who do become infected will actually have a pretty mild infection. But there's still a small fraction of our neighbors and friends that will have more serious disease and require more intense care. And I would like people just to understand that we're ready to provide for them. We're building up our capacity. We're making contingency plans every day, that the community is together and really has come together in a way that I think is just remarkable. And everybody in Cincinnati who's contributing to this really should feel proud about how we're taking care of one another.
Great point. And I think what you're saying also is that even if we're not health professionals, that reaching out to older neighbors, to someone who you think may be managing small children and not have enough assistance, we can all do things for each other while still observing all the safety precautions that are becoming our new normal. I'd like to introduce now Christa Hyson from the Health Collaborative. Christa, you've been working on this crisis at the ground level, and what are you seeing from a public health perspective in addition to what Dr. Lofgren has already shared with us?
Absolutely. So thank you so much for Dr. Lofgren and to the Chamber for having us as well. And thank you for stressing the importance of the collaboration in times of need. That's simply why we exist. But I wanted to take a minute and kind of explain why public health is a little bit different and why you're kind of seeing all these emerging things coming out. So understanding public health accomplishments is different because they are measured by, something different, meaning that success is defined by what is prevented and not as what is produced. So when public health is successful, it's invisible. We kind of take it for granted. We don't celebrate diseases that we don't have, that we didn't know existed. Working in public health, we train, we prepare, we exercise these worst case scenarios. For example, our last pandemic, H1N1, our country has built up a herd immunity to something like that. And we had a foundation for a better vaccine. And most states had the capacity to diagnose H1N1 without a CDC verification test. But with COVID-19, we don't have that luxury. We are constantly working as fast as we can to be experts in a virus that we didn't know existed 6 months ago. So from the public health perspective, that is why you're hearing all these different things like social distancing, like the reiteration of, really talking to your primary care doctor before doing anything and putting into harm's way. Could I have my slides pop up? Thanks, Michelle. So I wanted to also take a moment and introduce the Health Collaborative, because outside of the healthcare world, you may or may not have heard of us. So our vision and mission are there, but I really wanted to say that we're a nonprofit organization that bring together those that pay for care, provide care, receive care, and find solutions to problems like this one. And more importantly, we run the Greater Cincinnati Disaster Preparedness Coalition. And what that means is kind of what Dr. Lofgren was discussing. We've got hospitals, we've got health departments, we have emergency management professionals, social service agencies, all working together to make sure that this region has what they need. So in addition to fulfilling those PPE requests, those masks, the ventilators, pop-up hospitals, if you've seen in the media, all the large tent hospitals, those are things that we're providing for the region. Next slide, please. So that's just a little bit about us. Next slide. So I wanted to kind of take a moment and talk about this. So I'm sure you've kind of seen this animation go back and forth. We're trying to change the narrative that this isn't just another flu. We don't have that seasonal herd immunity anymore. What we're really trying to do is, if you've heard the flatten the curve, that means that you have a part to play in this. If our healthcare workforce is not prepared, this could be potentially a very large issue. So that's what we're meaning to do when we talk about flattening the curve. So if we don't have the tools and resources available to us in public health, that is what that means. So we are trying not to overburden the healthcare system by spreading out the number of cases we get instead of it occurring all at once. So that's why those measures of social distancing. Could I have the next slide? So I wanted to talk a moment about social distancing. Basically, the most important thing right now is to follow the advice of Dr. Amy Acton. She has been absolutely amazing in this part. A lot of the questions have been really great during Governor DeWine and Amy's press conferences, just because of the calm that they preside. And one of the things I wanted to stress was really Ohio is doing a fabulous job in responding. They are taking care of our population in a way that other states aren't, and I'm really, really proud of that. In this region, we have the collaboration and the capacity to surge if needed. We are not there yet, and that's something we don't want to get to, and that's why it's important to keep our population well. And that includes the healthcare workforce. One of the things that people have been asking about are what are the number of beds? What are the number of ventilators? What's kind of going on numbers wise? And I really want to get out there in the community is it's not just about the number of beds or the number of ventilators. What about our healthcare staff? Because we can, with surge capacity, we could effectively double the number of beds we have, depending on the size of the hospital. But it's about keeping the healthcare workforce safe so that they continue to work. That's why things like PPE allocation is so important. And that's why the personal safety of others, including things like social distancing, is so important. You know, our region has a really good track record of working together. So I think as long as we stay along the lines of, you know, if you do have those signs and symptoms, I know like I sound like it right now, but welcome to allergies in Ohio. But, you know, don't go to the emergency room if you are experiencing those symptoms. Make sure you talk to your primary care provider first, have that phone screening, and they'll decide what's best for you. If you do not have a primary care provider, call your nearest urgent care, and they will let you know what those next steps are to be for testing. You know, the most important thing right now for Greater Cincinnati is to, you know, follow those social distancing procedures outlined by our state and local governments. Wash your hands frequently, stay home from work, cover those coughs and sneezes. And if you are a high-risk individual, the CDC and ODH, the Ohio Department of Health, has great checklists that involve everything you need to watch out for. But I'd say in this biggest time, keep in mind that we're all working together, we're all in this together, and this is temporary. And I encourage everyone to utilize the resources we have in each other and the chamber to get through this. Thank you.
Thank you, Krista. Michelle, am I live again? Michelle?
Yes, you are live again, Mary.
Thank you. Just double checking. There's a little microphone glitch there. Thanks to you both for such clear and compelling information on the crisis. We have some questions coming in, and Dr. Lofgren, I know you've had a chance to look at those. I wonder if there's one that jumps out at you right away that you'd like to address.
Yeah, maybe there are two that I want to make sure that I address. The first one is, the question is there coordination efforts with key entities in Kentucky and Indiana? I think there are two elements. One is that there's no question that we are responding and taking the lead from Governor DeWine. That being said, we also recognize that the preparation, as Krista's mentioned, is local. The surge capacity is all local. And one of the things that's really an advantage of the Health Collaborative is that it's not bound by the Ohio River. We work collectively with people at St. E's and across into Indiana and the entire region. So when we talk about planning for our response to the community, it is actually the entire region that does reach across into Kentucky and Indiana, which are all very much part of the Health Collaborative. The other question I had is that local communities are supporting restaurants by ordering meals for carryout. But should this apply to high-risk category? Should high-risk category people participate? You know, Mary, I think this really fits to one of the things you suggested that you can do as a neighbor and a friend. If you have somebody who's high risk, and we really didn't talk as much about that, but clearly the risk of having serious complications, including respiratory failure, increases with age and increases in people who have pre-existing conditions like heart disease and lung disease. And those are the most susceptible people in our community. And in terms of being able to support restaurants and bringing meals to them and high-risk individuals, it'd be great if neighbors reached out to them and were able to do that for them so that they're minimizing the amount of contact that they have in the community. We need to make sure that we are focusing on those particular citizens in our community who are at the highest risk of developing complications from this virus.
Yeah, so just to be clear about that, there's no real danger to the carryout food itself. The issue here would be someone who's in that high-risk category going out to a restaurant to pick it up, interacting with other people. If a neighbor or friend picks it up, brings it home, that the person is at much less risk in that way.
Exactly, Mary. And as I said, it's not the food itself that's great. The risk actually for them picking it up if they follow the social distancing that Krista mentioned. But on the other hand, if you're high risk and you can help such an individual, it's wonderful. And that's exactly how we help each other.
Yeah, they're not touching surfaces and the like. I want to go back to something else you said, because you both have used a term frequently, and I don't want to assume that everyone understands it. When we talk about surge, what do we mean?
So I'll answer that, and then I'll have Krista give the public health element to that. And it really goes back to the graphic that she showed, is that if there is, let me back up a second. One of the things that's true about this virus is that it's new and nobody in the community has had experience to it. So we can assume that nobody in our community is immune from it, unlike other viruses where we have people who've been exposed in the past and are immune from catching it. So we're all susceptible to that. So if in fact we had a big surge, a large number of people that in fact acquired the disease at the same time, and even though the number of people with a complication is small, overall that could overwhelm our healthcare system and really be able to provide the appropriate amount of care. If on the other hand, we flatten the curve out as the census talked about, then we will always have sufficient ability to care for those few that get critically ill, and frankly, help us mitigate the infection long term. And I do think the other thing that I'd want to highlight as well that Krista mentioned is very important is that there is going to be another side and end to this pandemic. We will in fact get the kind of immunity in our community, and actually within a relatively short period of time, I'm confident that we'll have things such as vaccines available. But between now and then, we need to practice the behaviors that Krista outlined.
Great, thank you so much. There actually are a couple of questions, and Krista, I think these are absolutely in your wheelhouse. Going on with the conversation about carry-out food, I think this is something we all wonder. Why is it not a risk if it was prepared by an infected worker? And there are people volunteering in neighbors. Ariel's telling us that out in Wyoming, one of our suburbs, people are delivering food. Can you be very specific about hygiene practices that will prevent people from spreading the virus, say on the surface of the parcels that they're delivering?
So first off, I will say that local health departments are very active in kind of like the re-inspection of restaurants, kind of seeing, okay, we're under kind of a new way of doing business, and how are we evaluating those hygiene practices. So I do know Hamilton County Public Health and Cincinnati Health Department, those inspectors have been working their tails off, making sure that restaurants are doing things the right way. First off, I think I heard you say something about an infected worker preparing food.
The question
because
was, if someone was infected and was actually preparing food, what effect might that have?
So that's one of the reasons that Governor DeWine said you're going to be at work, make sure those temperature checks are there to make sure that people that are infected are not preparing food. However, we are hearing cases of people being asymptomatic. That's something Dr. Lofgren could speak more on. However, those things that the health department always reinforces, temperature of food, making sure proper things like hairnets, gloves, and the materials, everything that is used from cutting boards to knives to preparation to everything, the storage of things, the temperature of things, that is kept at the utmost hygienic qualities. If you have specific questions on those specific hygienic practices, I would reach out to your local health department, or usually online under their registered sanitarian. There's a lot of information on safe food prep. And then there was one question.
Kristen, had to do with the packaging. Yeah, when you bring it to someone else who's at high risk, do you need to do anything to essentially sanitize the packaging that food came in?
I mean, making sure that your hands are clean and touching a brand new package and delivering it to someone, that is the best thing. Just reiterating that hand washing, that's a very powerful thing to do right now.
And I want to thank you, Krista, for demonstrating the proper way to cough as well just now. For everyone
thank you. Yeah, allergies.
Yeah, so Dr. Lofgren, a couple of, I think, related questions. One came in actually yesterday as soon as we announced this webinar. Some people have said that we would be quarantined for 3 weeks, then 3 months, and now new reports say it could be 18 months before things get back to being normal. In your expert opinion, when will things start to settle down and get back to normal? And a related question from Becky is, you know, when do you think we might see the lifting of restrictions? Does it have to do with seeing a lower spread of cases? I mean, what's your, we know you don't have a crystal ball, but what might you say about the timeline?
I appreciate that. This is the most difficult question to be asked.
Absolutely.
So I think that there is no crystal ball. One of the things I would tell you is that there has been the suggestion that this virus might be seasonal like we see in the flu. We simply don't know that to be true or not. It gets back to that we really don't have a lot of knowledge about the virus or the infection. I do think that as the case load starts to taper down in that depiction that Christa had, that's when we'll start to see ability for us to go back to a more normal period lifestyle. You know, in terms of, you know, I'm confident that, you know, at 12 and 18 months we have immunity and we have a vaccine that this will be behind us. What's the steps between here and there? I'm not really sure. I do know that the more that we slow the rate of infection in our community and take care of one another, the faster we'll get back to normalcy. But as you said, I don't have a crystal ball in terms of when that might be.
Okay, great. Christa, representing the Health Collaborative, and I know you bring together all of our health systems in the community. We have a question about whether Cincinnati Children's is prepared to offer care to adult and high-risk patients to support hospitals like UC Christ and others. I don't know if you can speak to that, but I will ask it.
I can't speak to the specific policies of Children's. At this time, individual hospitals have the ability to surge if that need arises. So I don't think we are there yet, nor do I have details on their specific practices now.
Okay. And again,
Mary,
you mentioned the term. Yes, go ahead, Rick.
Yeah, I actually do have an answer to that. As you may know, this virus, unlike some of the other ones, tends not to have either affect children as much or nearly have the severity. And I can tell you very early in the process, the leadership from the Cincinnati Children's came across the road and offered that they would make their ICUs and ventilators and critical care services available to us if the need were to arise. So they have been incredibly strong partners and will be part of that surge capacity should the need arise.
That's great. Thank you so much for that. We had another question about to what degree are we prepared with materials about about COVID-19, about infections, about precautions, and so on, to meet our increased and growing immigrant community and individuals who may not have English as a first language. Could either of you address that question?
Yes, so we have activated what is called in an emergency a Joint Information Center. So what that means is we have communicators and public information officers from across the region, and we get together and see where the needs of the communities are. So we are in the process of translating a lot more information. We get good information from CDC, however, it's not specific enough for instructions of instructing someone to go to a specific hospital or a specific site or how to follow up with a physician. So we are making sure that those things are translated, and I was on a phone call this morning about getting more of our information in Braille as well.
That's great. I'm sure that will help not only our immigrant community, but then people with disabilities. We need to always remind ourselves that not everyone can access information easily. So thank you for that. Any final thoughts from you? Dr. Lofgren, I expect that this is unprecedented even in your long career in health. What would you say about this relative to, oh, hang on just a second. following up on Krista, where can immigrants access that info and in what languages is it provided? Do you have any insight on that?
So as soon as it is released, we will release it through the Joint Information System. So that is gonna, and then I believe the organization is called Cincinnati Compass. I think I saw a question from Brian. I'm emailing you back.
Yes.
Don't worry. And then, so we are focusing right now on Spanish, French, Mandarin, and I believe Arabic for now. And hopefully I will have more as the time goes on.
And you're absolutely right, on the Cincinnati Compass website. So if you just Google Cincinnati Compass, you can find it. Brian Wright, who's the director, has posted multiple language translations on the basics of COVID-19. And I believe those are also available as a tile on our COVID pages on the Cincinnati Chamber website. So good resources for the community to share with neighbors who may not have accessed this information. So Rick, back to you. I wanted to be sure you had an opportunity to just reflect for a moment before we close out today on what this means in the context of your long career and how you are making progress each day.
I appreciate that. You know, this particular pandemic, as it has unfolded, is unprecedented. Having said that, though, that we have had other pandemics and infections that was taught us a lot about how to respond. You know, people sometimes downplay what the impact of H1N1 was, but it really had a huge impact, and we learned a lot about how to control infections from that. It still resulted in 12 or 13,000 people of excess deaths in that regard. So we do have knowledge about how these viruses can potentially affect individuals and how we need to respond to them. And so it is unprecedented in terms of how contagious this virus can be and the fact that nobody in our community has immunity to it. But I do think we've learned along the way how we can effectively mitigate that in a way that was not true, you know, even 10 years ago. And so I think that the key element here is that as we have responded as a community each and every day, is to understand we have learnings. We have been preparing for the potential of this kind of outbreak in the past. We have policies and practices in place. We're activating them and really are taking, I think, good steps to really protect each one of the citizens and respond so that we can take care of everybody moving forward.
Thank you so much. I want to say thanks to both of our expert panelists today, Dr. Rick Lofgren of UC Health and Christa Hyson of the Health Collaborative. We're grateful that you took the time during the crisis to share your knowledge and to provide such great perspectives to our Cincinnati Chamber members and our partners throughout the region. And thanks to our audience for joining us today. Keep in mind that we have 2 additional webinars scheduled for next week with many more to come. On Tuesday, you'll hear from Matt Rich of Katz Teller on HR policies and procedures, managing your most important resource through this crisis, your people. And on Thursday, Dr. Chantel Thomas will complement that with a discussion on mental health issues and solutions, strategies for leaders and individuals to manage stress and reduce anxiety, timely topics to be sure. In addition, resources to support you throughout the crisis and membership information is available at cincinnatiChamber.com. Our entire team at the Chamber is dedicated to keeping our business community united through the crisis and strong as we recover. Please let us know how we can be of service to you. Meanwhile, stay safe and respect social distance, even with those you love. And as we sign off, take the time to wash your hands, really, right now.